We welcome you to our Health Corner segment today on KDIO. We have exciting news from Ortonville Area Health Services to tell you about. They're inviting you to a special event that is coming up. We'll welcome the CEO of OAHS. Rick Ash is here. Good morning, Rick.
Good morning. Good morning.
I haven't seen you in a while. How are you?
I'm doing well. Doing well.
Good.
Been around, but yeah, I haven't been here in some time.
I know.
Glad to be here, though.
Starting to feel bad.
I'm sorry. I'm not ignoring you.
Thank you. I appreciate that. Cindy Jorgensen is here from Northridge, too. Good morning, Cindy.
Good morning, Julie.
Thanks for coming in. And what is coming up that everybody should plan to attend in June?
Well, we're excited. I think we've talked a little bit previously about our building project, the Fairway View Senior Communities, a 34 apartment senior housing and the replacement of our skilled nursing unit, Northridge residents, 51 beds. So we're excited to celebrate groundbreaking, our official send-off to start the project.
And that is going to be?
It'll be on Tuesday, June 9th at 1:30 p.m. at the Fairway View Senior Communities building site.
And some refreshments will follow, of course.
Absolutely.
We're also going to provide transportation. They can park in the New Life Community Baptist Church parking lot, and we will bus them over to, just because the parking probably is a little cumbersome, and it'd be easier for everybody to come through that way.
Okay, that's good to know. So if they're going to park over at New Life Baptist Church, what time should they plan to?
We were thinking 1:45, 1 o'clock, and then we could have a couple buses going through there. We also have a golf cart if we need to, and make sure that everybody gets there safe. And could be muddy. We don't know what the weather's going to do for us.
No golfing in between beginning and end, though.
Okay, well,
That's true. And then if the event and the weather is inclement at that time, we're going to have a cancellation or postpone. We'll have that on June 17th at 1:30, and we'll have that announced on the KDIO radio and also on our website of OAHS.
Okay, very good. Now, despite the fact that this is the official groundbreaking, there's actually been some work going on already.
Absolutely. We are dedicated to having the completion of this first phase by the end of the year. So, there are folks out there that are already have taken and moved the garages and are starting to scrape the ground as part of the site work. So, yes, it's moving right along.
And the first phase that Rick is talking about is our 34 independent living units that we're having. We're going to build 10 two-bedroom, 12 one-bedroom with den, and 12 one-bedroom. Currently, Bonnie Didval from Fairway View and myself have been renting out those apartments. I think we only have about 11 of those left.
Really? Well, that's awesome. I mean, it certainly shows the need and the desire for folks to have this in our area.
It sure does.
Absolutely.
Now, I know you were going through the folks who were on the waiting list for Fairway View first. Have you gone through that completely?
We set up 3 groups of people. The first were the independent housing that live right at Fairway View, and offered them if they wanted to move into the new building or not. That was an opportunity for them. The second group we met with was the Fairway View waiting list. We called everybody on the waiting list, made appointments with them, and they could sign an agreement with us and set up a renting agreement with us. And the third group was the community that we had met with.
Okay. So if folks would like more information, what can they do? How can they get on the list for interviews?
They certainly can call myself, Cindy Jorgensen, Director of Northridge, at 320-839-4171, or Bonnie Didval at Fairway View at 320-839-2397.
Okay. Well, Rick, what are your thoughts about this? We haven't had a chance to talk with you about it. So where are you at with this whole process?
Well, actually, I think the bulk of the work, from my perspective, is occurred, and that's getting all the pieces together for the project to move forward. Working with the designers, the architects for planning and design, to getting the construction management firm, Haslund Construction, on board. Working with the building committee and the city, getting all the waivers and the easements and the land transferred and all the platting and recording. And then working with Kevin and Franzen Bank for the financing of it. So it's really been a lot of work going on behind the scenes that you don't get to see, but now you'll start to see some of the fruits of that labor.
How long have you been in Ortonville now? Is it 8, 9 years?
It was February of '06, so it'd be a little over 9.
Okay. In that length of time, we have seen a new hospital built, and now we're working on this new facility, and it's like, wow, you're going to be like the builder for the community.
I have to say that I think the focus has been is addressing the needs of healthcare in the region, and working with the board, the medical staff, and everyone up at OHS in the community, we're just doing the things that are needed.
Absolutely, yeah. But without some direction, it wouldn't be completed. So
well, we've got a very strong board too. I mean, they are very community minded, and that makes a difference.
And maybe we should mention the board members.
Absolutely. Well, first of all, our board chair is Ron Thomas. And then our vice chair is Dr. Al Ross, and our secretary treasurer is Dr. Chris Conroy. Then we also have Michelle Knutson, Marilyn Lindahl, we have Mike Dory, and we have Janie Stecker. So those are the 7 that make up the healthcare board. And then, of course, out of that was the building committee that was appointed by the healthcare board that does a lot more of the day-to-day with this project. And so Mike Doherty is the chair of the building committee. Okay. And then Michelle Knutson and Janie Stecker are the other 2 members of that committee. And then Ron Thomas is an alternate if one of the others is not available.
Okay. What else do you have?
Oh, well, I think we're just excited. I mean, it's hard to really paint a good picture on the radio. But what we are going to be doing, some of it will be at the groundbreaking ceremony. We're going to have some pictures so folks can see what it's going to look like at completion. We're also working with our design professionals to get some graphics to be able to make available on our website. And then, of course, ongoing communications, trying to make them available, maybe some things in the paper and other areas where we can show folks what's going on. I think, it's hard to stand there right now and just look at that grader going back and forth, doing the site work and picturing in your mind what that's going to look like.
Right.
And once you see some of the, what I'll call the 3-dimensional printouts, it really is quite amazing, the scope, the size of it all in relation to the current fairway view. And I think it says a lot about what the community needs for healthcare, both from the hospital and clinic side, but also for the long-term care, the senior services, independent housing, senior housing, assisted living, and, of course, skilled care.
Absolutely. Yes. Now, the project that is currently under construction is what you refer to as phase 1, right?
True. That is the independent housing.
Well,
okay.
Just to clarify, there's what I'll call 2 phases, but it's all one project.
Okay.
So the total project is the senior housing, the 34 apartments, and phase 2, which is the 51 skilled beds. So together, along with connecting that to the existing fairway view, is what we're calling the project, and would be considered a continuing care retirement community. The CCRC is the term that you hear in the industry. For regular folks, it's it's trying to get all the services under one roof to age in place, if you will.
Sure. Okay. Now, Cindy, when are you looking at starting to rent these units? When can people think about moving in?
When we were doing lease agreements, we said the end of December or by January 1st of 2016. There's very much excitement with the people that we've talked to that are rented. They're talking about how they're going to have to downsize and get things ready to go, but they are so excited to come into this building. They've been waiting a long time.
Oh, yeah. And, to have a brand new place to live that's nice and tidy and up to date and has a lot of different amenities too.
It does. Also with that phases that we're looking at as the independent housing is built, we're going to be doing that town center, and we've talked a lot about that with the independent housing, how that they will integrate with that, and they're very excited about that. We're going to do the continental free breakfast in the morning, and we've are going to integrate the independent housing at current Fairway View with that also.
Okay. So when do you look at the possibility for the next portion of this process to begin?
Well, our plan is for the phase 2, or the other part, if you will, of the whole project. We'd like to have that completed by December of 2016. So by the end of this year for the senior housing and by the end of next year for the skilled unit. It's actually, the focus is on senior housing, but there's going to be other work that needs to be done for the phase 2 part of it. So some of it's going to be simultaneous. But in order to make it all work and get things up and running as quickly as possible for the folks who are looking for senior housing, we're focusing on that phase 1 to get that done first.
Okay. What are some of the questions that you're hearing from the public about this whole process? I know you've had different meetings where people could come and look at the drawings and that kind of thing. Anything that comes to mind?
Well, I think a lot of the questions that we received are part of the design that we put together. Some of the amenities, a place to meet, having the community available, a sitting area, a library area, places that can maybe be quiet for families to get together and not feel like you're all in one small little room. Private rooms, those kinds of things are high on their list.
And I think another thing that's high on their list is when we tell them there's a garage for them that they could use. They're very much into that. With the elderly being snowy and rainy or whatever, it could be outside. Everything is inside for them.
Yeah, that would be a huge bonus.
Yeah, actually, sorry to say, but all the garages are already rented. And I think part of that, is the fact that they're all 24 of them are under one roof. So you can go right from the senior housing right into the garage. You don't have to go outside and brush off or warm up the car, so to speak.
Yeah, absolutely.
Yeah.
Well, of course, they furnish their apartments with their own furniture and that kind of thing. But what are you looking at as far as maybe some of the commons areas?
Well, first of all, there's a common dining area in the lower level in the middle of the building that overlooks Fairway 13. And so you'll be able to have a wonderful, very open area, glass open area to see the outside. So there's an opportunity to use that for dining or for activities or other kinds of things or events that you want to have. Upstairs on the second level, just right above the dining area, it's not another kitchen area, but more so of a what I'll call a family area or an area for also groups to meet or families to meet. Just some space that can be kind of out of the way and feels safe and comfortable and warm. So.
And we're also putting in 3 small apartments for families to use as they're visiting their loved ones here. 2 are going to be on the top level.
Yep, right on each side of the commons area.
Right.
And then one downstairs that's right off of the main entrance.
Right.
And there, if you think of a regular motel room, that's really what it's laid out for, is just a place to hang your hat, if you will, for a night or two, and be close to family. So
now, is there a charge for that accommodation?
There will be. We're not sure what that price is going to be yet, but it'd be certainly comparable to whatever is out there.
Sure. Okay.
Yeah, I think we're really looking to cover costs, I guess, if you will. At this point, it's not a profit motive. It's making it an amenity for the folks who live there and their families.
Well, it sounds like it's going to be a fabulous, fabulous facility once it's all put together and you get all that landscaping done and you think, wow, finishing touches. But that's a ways off, I know.
I know, it is. But it is going to happen. It's kind of like the hospital. That was a 3-year project. And look how it ended up. I mean, we were, I think, diligent with our dollars, but we ended up with a very, very nice facility and the tools and the resources needed for the people to do their work. We see this being the same thing. It's tools for the staff to provide care, or it's habitat for people to live. Even the outside, some of the landscaping is a little different than what you would see around the area, and very interestingly of how it's set up to manage even the water flow, the watershed, by utilizing the landscaping in the gardens and what I'll call walkway areas. I believe the design is set up so that if you wanted to walk all the way around the campus, you can do that. And
really?
So there's an opportunity for that. There's a little gardens area in between a couple of the cottages. So, I mean, it really is trying to provide a healing and living environment. And the outside, for the 2 months out of the year that we have summer, you get to enjoy that. And maybe there might be some skiing in the winter, cross country, around the campus. All right, that might be a little over the top.
Interesting thought, though, Rick. I got to give you that.
One other thing I want to say thanks. I mean, there's been so many people that have worked hard on this. It's been a complicated project, simply because of all the different disciplines and areas that it crossed. It was different than the hospital that was done right already on campus.
Sure.
And so, the city has had to work through a lot of hoops and a lot of technicalities and ordinances to allow this to happen. The EDA has been marvelous with working with us to make this happen. Their mission and commitment to bring more senior housing to the area is just amazing. We couldn't have done it without them. Of course, working with Haslund Construction, our design people. Everyone, has come together, and we work through the challenges, and that's what it takes I think, for a strong community to have what they're going to have is working together and working through some of the challenges that are before us. So, I just want to say thanks to those folks, and also just a quick thanks to Pastor Phil and the New Life Community Baptist Church, who not only is allowing us to use their parking lot for the groundbreaking, but also has allowed the site developers to actually use their parking lot as a road to access the project so that the large trucks aren't coming down Lundell. And for those living on Lundell and in the area, I can't imagine how thankful that they would be if they could have experienced that. So
sure,
thanks for that as well. So everyone's just pitching in, and we're taking on the challenges one day at a time, and we're getting there.
Well, and, speaking from a perspective of someone whose parents are aging, something like this is a huge, huge thing for our community. I mean, badly needed.
Yeah.
So it's good to see that it's happening.
And we're all very excited about it.
Yeah.
Absolutely. We in the initial discussions, some of the information we were getting where people were leaving the community because there was no openings, and getting an opening at the existing Fairway View was next to nil.
Right.
So this is a way to keep people in their community, in their neighborhood, with people, their support network, folks they love, and obviously, of course, it helps make our healthcare system strong as well.
You bet. Groundbreaking is going to be Tuesday, June 9th at 1:30 at the facilities up by Fairway View in Ortonville. They'll have refreshments following. And if folks are interested in getting more information, they just want to talk about some possibilities, what can they do, Cindy?
They certainly can call me at Northridge. I'm Cindy Jorgensen at 320-839-4171. We'll help you out with questions. We'll get you answers, and we'll get back to you.
All right. Rick, did you have anything else you wanted to add before we go?
No, just excited and looking forward to sharing more. And I hope folks will be looking at this because we're pretty proud of the work that everyone has done.
Absolutely. Thank you both for being here.
Thank
you for having us.
On our Health Corner, that's Cindy Jorgensen and Rick Ash joining us on KDIO.